Hello all. Today we will see vitamin C. We will briefly see a case or two of vitamin C deficiency, and we will then discuss what are the reasons behind this deficiency, and then some little bit of theoretical part of this vitamin C deficiency. See, whenever you see a case of vitamin C deficiency, so this case might be like this. A child around 7 years old from a poor family was brought to hospital by his father with the complaints of loosening of teeth, poor healing of wounds, swelling around long bones, swelling, sponginess, tenderness and bleeding of gums. The patient is anemic and weak. So this is the history of patients, and so whenever we see a patient, we will ask a history, then we will ask him for do some test, and sometimes we will go for clinical examination. So whenever we have a case of any disease, we will go and we will look for at least 3 categories like history, then investigations, blood investigations, and then clinical examination. So in this case, what is the probable diagnosis? That is the first question. And what are the reasons for these symptoms? Second case may be like this. A 25-year-old working bachelor had been eating only bread, cheese, boiled eggs, milk and canned food, which lack fresh vegetables and fruits for a few months. So this is the important part of a history, which lack fresh vegetables and fruits for a few months. He then observed small red spots, that is called as petechi, on his legs and swollen, painful, bleeding gums. So again, this is a very important point. He consulted a physician with a complaint of swollen joints which are tender to touch and blood in the stools. So it is also called as melena. So this is a history. So whenever you read history, there are key points. So one key point is lack of fresh vegetables and fruits, then red spots or petechi observed, then painful, swollen and bleeding gums. This is the key term, and then blood in the stool. So on investigation, he is found to be anemic. So again, this is the investigation. Like for example, hemoglobin is counted, and then if it is anemic, again that is a point in favor of vitamin C deficiency. So the question is, how do you interpret the case and what is your probable diagnosis? So in case of vitamin C deficiency, always look for keywords. Keywords for bleeding gums, swollen joints, poor healing of wounds, swelling around long bones and anemia. So this is a typical case of scurvy. So you can see here bleeding gums, and again there is periodontal disease. So anemia, so pale skin, then sunken eyes and bleeding gums. So coming to the theoretical part of vitamin C. So vitamin C sources: citrus fruits, green peppers, strawberries, tomatoes, broccoli, sweet and white potatoes, etc. These are the excellent sources of vitamin C, and we also know that gooseberry is also a good source of vitamin C. So we have seen in a previous case, the patient did not take green vegetables or fruits. So again, because of lack of these foods, there may be vitamin C deficiency. So coming to the recommended daily allowance of vitamin C. So for adults, it is around 60 milligram. Pregnant woman, 70 milligram. lactating woman 95 milligram, and in case of smokers 100 milligram, because there is increased formation of free radicals and vitamin C is antioxidant, so the requirement is increased. So coming to the functions of vitamin C. So vitamin C is required for various things. So like it is required for steroid biosynthesis, hydroxylation of proline and lysine. It acts as antioxidant, also for synthesis of catecholamines, bile acid synthesis, absorption of iron in the intestine, catabolism of tyrosine, and also folate metabolism. So these are the key points regarding functions of vitamin C. Out of these, in clinical respect, this is important. We will see how this is important. Hydroxylation of proline and lysine. Again, absorption of iron in intestine. So if vitamin C is deficient, iron cannot be absorbed, or it is absorbed in less quantity, and it leads to anemia. Also, it is an antioxidant. So if the level is decreased, there is increased free radicals and increased damage. So vitamin C, as we have seen, it acts as an antioxidant. So it regenerates functional tocopherol. It helps in prevention of atherosclerosis. Also, it is said to prevent cancer. So this is the effect of antioxidant mechanism of vitamin C. So one of the important function of vitamin C is hydroxylation of proline and lysine. This is post-translational hydroxylation. This is an MCQ. This is very much important for collagen biosynthesis. So what will happen if this vitamin C is deficient? So if it is deficient, there will not be hydroxylation of proline and lysine, and it leads to abnormal collagen. So collagen is not proper, and we know that collagen is present in the skin, in the gums or germs, and whenever it is not normal, so the minute trauma will lead to bleeding, breach of the mucous membrane or breach of the skin. So there may be bleeding gums, and for wound healing also collagen is required. So whenever vitamin C deficiency is there, because of lack of hydroxylation of proline and lysine, the collagen is not synthesized properly, and it leads to bleeding gums presentation, delayed wound healing, and other problems. So this is very important in clinical respect. So vitamin C is functionally most relevant for triple helix formation of collagen. So again, this is important, as we have seen, because decreased deficiency or decreased vitamin C level leads to lack of hydroxylation of proline, and lysine. So it results in impaired collagen synthesis. So we have seen this proline and lysine hydroxylases are required for post-synthetic modification of procollagen to collagen, and vitamin C is necessary as a coenzyme for these hydroxylases. So hydroxylases require this vitamin C, and whenever it is deficient, hydroxylation of proline and lysine is not found there, or it doesn't occur. So there is decreased conversion of procollagen to collagen, and the collagen is abnormal. Coming to the other functions, it is required for corticosteroid hormone synthesis. One of the important point is immunological function. Vitamin C enhances the synthesis of immunoglobulins, that is antibodies, and increases the phagocytic action of leukocyte. So this is again clinically important. In case of vitamin C deficiency, the patient will have frequent infections. So this is a clinical history. most of the times patient will give history of frequent infections because vitamin C is required for synthesis of antibodies, these are immunoglobulins, and also for increased phagocytic action of leukocytes. So, and in therapeutic aspect, again we will prescribe vitamin C, or we advise to take vitamin C in large quantity after infection. Again, it helps in preventing or fighting infection. Next point is bone formation. Bone tissues possess an organic matrix, again collagen and the inorganic calcium and phosphate. Again, vitamin C is required for proper bone formation as in case of collagen. So if vitamin C is deficient, again bone will not be formed properly, and we have seen the patient may be having swelling at the end of the bones. So in a nutshell, vitamin C deficiency manifestation: hemorrhages in various tissue. So this relates to clinical presentation: petechiae on skin or bleeding gums. General weakness, anemia, we have seen that. Again, swollen joints, swollen gums and loose teeth because improper collagen. Again, susceptible for infection because vitamin C deficiency leads to decreased antibody formation, and also vitamin C helps in phagocytic action of leukocytes. So if it is not there, phagocytic action of leukocytes is decreased. Again, the individual is susceptible for infections. Delayed wound healing, again we know it is for cross-linking of collagen, that is proper collagen formation. So delayed wound healing, and bone fragility and osteoporosis. So these are the very important key points about vitamin C deficiency. So who are at high risk of vitamin C deficiency? Again, this may be useful for taking history. So people who have increased physical or mental stress, so like infection, fever, burn, surgery, trauma to soft tissues or bones, chronic illnesses such as hyperthyroidism, diabetes mellitus, rheumatoid arthritis, alcoholism and kidney failure. So increased physical stress. Chronic use of some drugs such as aspirin and oral contraceptives which impair the vitamin C level in the blood. Older people, particularly those with chronic illness and aging, and in case of periods of rapid growth, because in these ages individuals require more vitamin C, and if it is not given, they are prone to vitamin C deficiency. So these are the one of the groups which are at high risk of vitamin C deficiency. Coming to the therapeutic uses of vitamin C, as earlier we have seen, vitamin C is useful for maintenance of immunoglobulins level in the blood. So if high amount of vitamin C is there, antibodies are in optimum amount, and also it increases phagocytic action of macrophages. So it is useful in common cold, also in cancer, because we have seen vitamin C is antioxidant in nature. So it prevents formation of free radicals, and ultimately it prevents sometimes occurrence of cancer. So coming to the prevention and therapy using vitamin C. So it enhances the ability of an individual to fight infection. We have seen this earlier. Vitamin C stimulates the activity and ability of WBCs to destroy bacteria and viruses. Treatment of common cold and flu at doses of around 1 to 2 grams daily. It slightly increases body temperature. Also, it increases functions of WBCs and levels of blood histamine. So, increase immune response, decrease nasal and bronchial congestion, decrease duration of symptoms of cold and flu. So, this is the mechanism of vitamin C that can be used, or it helps in tackling of common cold and flu. Also, it helps reduce risk of cancer. So particularly cancers of gastrointestinal tract, bladder, breast, pancreas and uterus, it is useful as it is antioxidant and enhancer for immune defense against cancer, and it helps detoxify carcinogenic food additives, for example, nitrates, pesticides, and other chemicals and heavy metals. So it is antioxidant, increases immune defenses, and it detoxifies carcinogenic food additives. So 3 mechanisms. Also, large doses of vitamin C decreases platelet aggregation, so it reduces risk of blood clots. So it reduces the risk of blood clots. In addition, vitamin C increases the strength of blood vessel walls. So by these mechanisms, vitamin C can protect from coronary heart disease, thrombotic stroke, and peripheral vascular disease. Also, it improves healing of wounds and fractures in burns, trauma, and surgery. We have seen vitamin C is useful for hydroxylation of proline and lysine, and ultimately proper formation of collagen. So it is useful in healing of wounds and fracture. Also, iron deficiency, by increased iron absorption from meals, and we know it prevents occurrence of scurvy or it cures scurvy. So coming to the toxicity of vitamin C, vitamin C is manageable up to 2 to 3 grams per day, but if it's taken more than 3 grams per day, it is undesirable and it may lead to toxic effects. Generally it is safe, but more than 3 grams per day is not advisable. So we have seen previously 2 cases. So again we will briefly see a case. So what you will look for in case of vitamin C deficiency? First thing, poor wound healing, bleeding gums, petechi, delayed wound healing, the point, very important point, and we will see other points as well. Again, and the history of lack of intake of green leafy vegetables and fruits. So we will see a case. A 34-year-old working male had been eating food which lacked fresh vegetables and fruits for a few months. Again, lack of intake of vegetables and fruits. He then observed petechi, small red spots in legs, swollen, painful and bleeding gums. On investigation, he was diagnosed as a case of scurvy. So the questions will be like this. Write down the functions, daily requirements, absorption and deficiency manifestation of the vitamin which causes this disorder. Other case might be like this. A child around 7 years old from poor family was brought to hospital by his father with the complaints of loosening of teeth, poor healing of wounds. So again, same points will be there and we will be able to find out the reason behind that disease. So that is the vitamin C deficiency that leads to scurvy. So this is all about scurvy. Thank you.